Welcome to Medyascope. We are visiting different destinations in Europe to learn more about their COVID-19 experience. We feel it is very important to have access to correct information direct from the source, from locals. Today, we are going to take a look at Belgium. Belgium is the hot topic in global media with high death tolls and number of deaths compared to the size of population. Why are so many people dying in Belgium? Is there a mismanagement crisis in the government, or are they more honest and transparent than the rest of the world in terms of counting and reporting? To find answers, we will be turning to journalist Robin Ramaekers. And Robin, it's very good to have you here. There's so much to talk and so much to clarify. Without wasting any time, let's start. The first question, the first topic that I want to mention is Belgium appears to have the highest coronavirus mortality rate in Europe. Even President Trump was showing a graphic, suggesting the US was handling the pandemic more effectively than the small European country, Belgium. I believe the reason behind the numbers are the main subject for global media. A high death rate might be related to the counting system. Belgium not only counting confirmed COVID-19 deaths in hospitals, but they are also including suspected deaths in care homes too, right? Is Belgium actually reporting in a more correct way? What is your opinion?
Well, the interesting thing about Belgium is that our government has decided from the very beginning of the crisis to count the number of corona casualties in a very different way than almost any other European country or any other country worldwide, as far as that's concerned. As you said, we have been counting not only the people that died in hospital as confirmed corona cases, but also the people that died in elderly homes, which amounts for the biggest share of the number of deaths that we've had so far. And these people have been counted as corona victims even without proper proof of the fact that they actually died of corona, which kind of inflates the numbers, but also gives a very realistic view of the number of people that probably have died from corona. So on the one hand, you could call it a very bad PR exercise, because as you rightfully mentioned, it's been in the media worldwide. The chart that Donald Trump showed Belgium on top of the chart, and he didn't refer to Belgium himself, but you could see it up there. So in that sense, it's a very bad publicity exercise. But on the other hand, you could also say that in the near future, all of the European member states will have to come up with realistic numbers. And once that happens, you'll probably see Belgium slide down the table quite a bit, which doesn't mean that we've been in a corner of Europe where things haven't been all that bad. Today, the last count has been 9,080 dead people, which for a country as small as Belgium is a lot, no matter how you count the deceased people. 9,080 people dead is a lot and very important.
That's why my second question is about that. Even the system, the ways can be different, counting systems, but what is the public opinion towards the death toll and mortality counting system in Belgium? For instance, in Turkey, the decrease in numbers motivates people and helps them gain confidence for normalization process. What do people on the street think about the statistics? Because numbers are high.
Okay. I think the first thing you have to know is that public trust in the healthcare system in Belgium is huge, because the trust in what was going on since the beginning of the crisis, taking care of people coming in with corona symptoms, was also very high. a very interesting thing about Belgium is that we, until today, still don't have a proper functioning government. We had elections, general elections, almost 1 year ago, May 27th, 2019, if I'm not mistaken. And until today, we don't have a proper government. So what happened when the crisis broke out is that the control of the crisis was almost immediately handed over from our temporary government to a committee of specialists, healthcare specialists, that really decided what was going to happen, when, and how. And the public trust in those people is and was much bigger than the trust would be in any politician saying you have to do it this way and not that way. So that was a good thing for Belgium. Another thing to keep in mind is that a lot of people here really focused on the situation as it was happening in Italy. Belgium has very strong ties with Italy. A lot of Italians moved to Belgium in the 50s, as a lot of Turkish people did afterwards in the 60s and 70s. So these ties and the fact that as Turkey, Italy is a very, very popular holiday destination for Belgium, the focus of the people was really there. And they were looking at the horror that was happening in Bergamo, for example, or in Milan in the north of Italy. And I think people tended to compare the situation here to what was happening there. So in that sense, there has been no public outcry about the fact that Belgium was not taking care properly of victims of COVID-19. Until today, there hasn't been any public commotion about the fact that our healthcare system didn't take care of these people properly. Quite the opposite. The healthcare system in Belgium is so elaborate that even with these huge figures, only 50% of our intensive care units were used at the peak of the crisis. So the system never crashed, which is the biggest problem of Italy, for example. The system in the north totally collapsed.
Yeah, health system and the hospitals, they were all crashed. That was the problem. They couldn't fix it still. Yeah. They're just trying to find a solution. But let's talk about the post-pandemic Belgium. What do you think about that? When will we get a state of mind that dictates what's done is done and it's time to focus on the future? And what kind of cultural and social changes will you experience? What do you think?
I think we're really entering a much more difficult phase of the whole situation now. Also a phase where the political decisions become more important. Locking down a country based upon the advice of medical experts is not that difficult a thing to do. Reopening a country step by step is much more complicated. And here politics come into play. Obviously, people in Belgium, on the one hand, want everything to be as safe as possible, but on the other hand, want business to get back up and running as soon as possible as well. And there you feel the different political tendencies coming into play. Some political parties want to go as fast as possible. Others are more careful, and you start feeling the frictions between those different parties that all try to get it their way. So it's a very complicated situation right now, where step by step we're opening up. When I go outside now, I see a lot more traffic here in Brussels. I see a lot more people walking through the parks as if nothing's ever happened, without wearing mouth masks, without keeping proper distance. Everything I've seen in Italy, for example, when I was there about 10 days ago, is completely different from what I see here in Belgium. So if we're not careful, we risk ending up in a second phase of this whole epidemic disaster, and that, of course, is to be avoided at all price. And that's exactly the difficulty that political parties are facing right now.
we can talk about politics after you said, hundreds of medical staff have protested against the Belgian prime minister. They really turned their back on.
Yeah.
They just turned. The photo of that moment was one of the most epic scenes, captured by the European press. Could you give me the details of the protests? Was this a silent protest about mismanagement of COVID-19, or was it about, some other dispute?
Very interesting example of how media work. I mean, when I saw the images of this protest, I was also struck because it was a very powerful image and a very painful moment for the prime minister entering that hospital. But it also tells you a lot about the way media works. You have a strong image, and of course that strong image starts circulating without necessarily giving it the proper background. What happened here was the prime minister was visiting one particular big hospital in the center of Brussels, and people in the hospital, represented by a socialist trade union that's quite strong in that particular hospital, were called upon to do this action as a symbolic action during this visit of the prime minister. What it was about was a law that was recently passed in Belgian parliament during the crisis, a law that says that you can move medical staff from one hospital to another hospital when there's a peak in the crisis. For example, this Brussels hospital doesn't face a lot of COVID-19 victims at a certain moment, but a city somewhere else in Belgium may have a huge problem. This law, in emergency situations, allows medical staff to be moved from this one Brussels hospital to any hospital elsewhere in the country. This is something that a lot of medical staff is opposed to because it would obviously create a lot of problems for the people involved. So the protest was really focused on this one particular law. That, in combination with the fact that for many years now, medical staff and specifically nurses have been complaining of the fact that they are overworked, that they are underpaid, and a number of other social issues related to the funding of the healthcare system. Now, the whole of Belgium is completely 200% behind everybody that's a doctor or a nurse. As in most other European countries, they are our heroes. That's the way it's also publicized. Support our heroes, and rightly so. But you have to understand that for unions, trade unions defending the rights of these medical professionals, this is the ideal moment to basically make a very clear statement. Don't forget about what we've been doing for you. And in the next negotiations, we want, our rightful demands to be taken very seriously. So that was kind of the message they were giving the prime minister. But in a broader context, there has been no protest whatsoever in any hospital in Belgium for the last 2 months until this one very strong and very mediatized protest by 100 people that turned their back on the prime minister. So that's the context.
It's so strange. You say, this action had political roots. That was that message, something totally different about unions and trade unions and about the law. But when you follow this story on the global media, it was something totally different. Also, if you don't get into details from the picture and from, you can easily say there's a mismanagement issue in Belgium. It's about COVID-19.
If you combine the image of the charts that show Belgium on top, and you have no idea why this is so, what I just explained about the way that you count the number of so-called corona victims, and you combine that with the image of 100 doctors and nurses turning their back at a hospital on the prime minister when she visits the hospital, of course, the logical conclusion, without any background, is, whoa, huge mismanagement of this crisis in Belgium, and the medical staff is protesting because of that. Unfortunately, that's not what's going on. There's a lot of things to criticize about the approach of this crisis as far as Belgium is concerned. But the numbers and the hospital system, the healthcare system, they're not really part of the actual problems that we're facing.
What did you think? What did you feel about when you see the graphic of Donald Trump? Belgium was on the top. He was talking about numbers. He didn't examine something correct. That wasn't logical. If you follow the news, if you know the details, it wasn't logical at all. But what did you feel?
Well, as I said, I thought it was a very bad PR exercise for Belgium. People in charge could have made a different choice in the beginning of the crisis to try to minimize the numbers, and in that way, come across with a much better perception of Belgium internationally. But I think in the long run, correct figures, or even figures that are slightly exaggerated, is better than trying to underestimate the impact and just trying to do a good PR exercise and not really taking into account what's actually happening. And there's a number of countries worldwide that are more concerned about public perception than about the reality behind the walls of the morgues and the hospitals and the elderly homes in their countries. And I'm not going to give any names, but
Thank you so much.
Which may be referring to.
It's too easy to guess. No need for names. Thank you so much. It's too easy to guess. You are in Brussels, exactly at the center of the EU. And what do you think? What's the general opinion about the EU's performance during the pandemic? Do you think that the EU should have done more to help Belgium cope with the difficulties, or do you believe the pandemic could have been handled better internally? What do you think about government and the EU?
I think as far as Belgium is concerned, people in Belgium weren't expecting the EU to come and help us deal with this crisis because there was no real need. Luckily, we had a lot of casualties, but the healthcare system functioned as it should. And as I said, only 50% of the IC capacity was used. So there was no real need for European assistance. At the same time, I think a lot of Belgian people, as a lot of other European people, when they look at the role that Europe has been playing, the European Union has been playing in this whole crisis, that for a lot of people, it confirms that when things get really, really bad and really difficult, all the member states kind of fall back upon themselves. They deal with the crisis the way they think they should deal with the crisis. And Europe, the EU, doesn't really play a role in it. I think the role that the EU has to play is now slowly starting to start up. When you hear that today, Merkel and the French President Macron decided to come up with a huge financial program, aid program, to help all EU member states in need. That's an important decision. And that's also a decision that countries like Italy and Spain have been waiting for a long time, and have been rightly so very, very angry about that there was no direct assistance when they were most in need. So the whole European Union idea, again, is up for discussion for a lot of people that have been Eurosceptic for a long time, as it is. So I think difficult times are ahead for the EU.
And let's talk about the media and the press, because the coronavirus has become a very strong topic in terms of freedom of press in a way that we have not experienced before. We were used to talking about human rights, women's rights, freedom of speech, and more all the time, especially in Turkey. But coronavirus has become a milestone for talking about freedom of the press in the world. And for instance, in Turkey, the media is polarized. A side is very pessimistic about numbers, that tolls, and the government attitude so far. And the other side is always all goes well, around no problem mood. What would you say? What would you like to say about Belgium's examination of this topic?
Well, in Belgium, freedom of the press has always been kind of a pillar of our democratic system, and also in this crisis, it's played its role, I think, in the sense that all the issues that we had, for example. One good example is the lack of proper mouth masks that Belgium has faced over the last few weeks or even months. That was heavily criticized in all mainstream media in Belgium. The problem there was that we used to have a stock of, if I'm not mistaken, over 50 million mouth masks. But media found out that stock had been destroyed a couple of years ago because of a political decision that it was too costly to maintain the stock, and that because most of those mouth masks were overdated, they decided to destroy them instead of to renew the stock. This was one of the big issues in Belgium media that was heavily discussed, and now also with the fact that, as I mentioned, we still don't have a proper government 1 year after the last elections, and that we really do need a full capacity government is something that's again more and more heavily debated in our media today, as it should be. Apart from Belgium, I think the fact that, as you mentioned yourself, in Turkey, for example, media are polarized about whether or not the crisis is properly dealt with, is a great thing. I mean, just the mere fact that you have different opinions in your overall Turkish media is a wonderful thing. So I think this kind of a crisis also brings along good things. The value of independent media shows itself in these difficult times. So, well,
we can talk about it.
I'm just going on with what you said about media being polarized in Turkey. If there is polarization, at least that means that there's different opinions. And different opinions is a good thing. If all the media say the same thing, then there's probably a problem.
Robin Ramaekers, thank you so much. That was good to have you, because we had so much to talk and clarify. Thank you so much about all these details and everything you said. That was perfect. Thank you so much. It was so good to know you.